It is my distinct pleasure to introduce Dr. Cynthia Clark. Dr. Clark is an award-winning tenured professor, clinician, scholar, and author, and the founder of Civility Matters. Her pioneering work on fostering civility has brought national and international attention to the controversial issues of incivility in academic and practice settings. Her theory-driven interventions, empirical measurements, theoretical models, and reflective assessments provide best practices to prevent, measure, and address uncivil behavior and create healthy workplaces around the globe. Dr. Clark's research includes both looking at incivility and strategies to mitigate incivility in healthcare environments as well as academic environments. She is a prolific researcher, presenter, and author whose presentations number in the hundreds and whose publications have appeared in a broad range of peer-reviewed and open access venues. It's important to note that her empirical measures have been translated into 16 languages and are used by scholars in more than 30 countries to measure incivility and to foster healthy workplaces. She is the recipient of numerous teaching accolades and awards in research and also service, and including the third-time recipient of the Most Inspirational Professor Award. It is with my great pleasure that I introduce to you Dr. Cindy Clark.
Okay. All right. Well, I just want to say hello to everyone. I want to welcome everyone and just express what an immense privilege it is to be here today. And Dr. Hedges, thank you so much for that kind introduction. And I also want to personally thank you for your support and enthusiasm for this topic and this session. It's been a pleasure working with you. I'd like to begin by, first of all, extending a very special thank you to the ResearchGate and especially Tarek and Praveen, who have had my back on this. And I appreciate that very much. And all the staff and organizers hosting this event. And I just want to thank all of you for being here for this session. And I'm very excited about this piece and the rest of the conference and a terrific lineup of speakers. So let me just, I'm starting my timer so I don't run over time. So let's talk a little bit about what we're going to be chatting about over the next 45, 50 minutes. And as Dr. Hedges said, leaving some time for Q&A. I want to start first by talking about what is this concept of civility and what is incivility? What are some of these other workplace aggressions that maybe you've seen or experienced or know about or have heard about from other people? We're going to really sort of focus on and characterize the role of leadership in fostering healthy work environments. Hence the title that we're heeding the call for courageous leadership. And then our last objective to really dig in a little bit deeper and explore an evidence-based pathway to build and sustain organizational civility and workplace health. So we have a lot to cover in a short amount of time. To begin, what I would like to do is share with you a quote from P.M. Forney. And P.M. Forney is the late former director of the Civility Project at Johns Hopkins University. And he said this in one of his books called Choosing Civility. A crucial measure of our success in life is the way we treat one another every day of our lives. And so when I think about or reflect on that quote, what it reminds me of is a recent interaction I had with a good friend of mine who's a nursing administrator and the director of education for a very large health system in the United States. And she was sharing some of the many challenges that their team is facing in light of the COVID-19 pandemic and its myriad manifestations. And certainly all of you are probably experiencing some of the things she talked about. And that was, she was saying, you know, our team is tired. We're tired, we're stressed, we're working a lot of long hours, we're working with very ill patients, we're worried about our own health and the health of our families and loved ones. We're putting together new curricula, we're onboarding new staff, we're getting up to speed on new technologies, and the list goes on. And you could probably add a whole bunch of items to that list. And all the while, the number of reported COVID-19 cases worldwide has just surpassed 11 million, and more than 2.5 million deaths have been reported, and thousands of these deaths are healthcare professionals and workers. So as she shared that experience, she was sort of going on, and then she stopped for a moment, and she said, but you know what? No matter how crazy or hectic or stressful it gets, no matter how many changes we go through, no matter how much it seems like things are out of control, there's absolutely one thing that we always have control over, no matter what. And she said, and that's how we treat one another and interact with one another. We have control over that. Which leads me to this question of, so what is civility and why does it matter? Why are we even having this conversation? Why are we, talking today about this concept and its correlates? And members of one of my research team and I are currently updating a concept analysis that I first published in 2008 on the concept of civility. And what we're finding is so interesting because the body of work from 2008 to 2020, which were our search parameters, the topic and the scholarly works on civility has just exploded. And especially since we opened our search parameters up beyond healthcare and into political science and politics. And you would probably not be amazed at how many papers have been written on the topic of civility since 2008. And what we're learning, because one of the goals that we had with the concept analysis is to formulate an operational definition. And our operational definition absolutely affirms the notion that being civil is a choice and that it's not enough to be merely civil. In other words, sort of standing silently by, saying nothing, being polite, and not really being an ally. Instead, what civility means, what we're discovering, is it's choosing to engage in a respectful manner, especially perhaps during times when we disagree or we have contrary opinions. And civility means promoting a sense of inclusion and equity, belonging, community, and meaningful connections. So let's think about what we mean by the opposite of civility. First, let me say that if civility is a choice, then it's a decision that we need to make every single day, in every encounter, in every interaction. And it means that we're showing respect for the dignity, the perspectives, and the well-being of others as well as ourselves. And this issue of dignity will come up again later in my talk. When we have civility, it helps us create work and learning environments where everyone feels valued and has a sense of belonging, which is a lofty, but I believe achievable goal. And civility helps us foster a milieu where inclusion, diversity, and equity thrive. But that doesn't mean that we blindly agree on everything and that we won't have conflict. In fact, we will and we should, and it's a good thing. But when we have conflict, it means that we're engaging in a respectful way and that we're having social discourse in such a way that we negotiate that conflict to seek common ground. So then when we say, okay, what are these other things? Workplace incivility and workplace aggression. And I'm going to talk about just a few concepts under the umbrella of workplace aggression. And the first one is incivility. What do we mean by incivility? And most scholars would agree that incivility includes a range of lower intensity acts of aggression. But if we fail to address them, these acts of aggression can escalate and can be perpetuated over time and can turn into threatening situations. And if they are patterned over time, we know, and the body of work certainly that I've done and others over the years, we know that the impact can be pretty devastating in terms of the psychological and the physiological, the emotional, the spiritual damage that these behaviors can cause. And so, just to name a few, and you could probably list many, many, many more, but let's start with a few nonverbals: eye rolling, finger pointing, door slamming. You'd be surprised at some of the stories that people have shared with me over the course of my career, just in nonverbals alone. Talk to the hand kind of gesture. But then there are more overt kinds of behaviors: spreading rumors, negative gossip, name calling, making degrading or belittling comments, put downs about our race or our ethnicity or our weight or our gender or our religion, or you name it, posting insulting comments on digital or social media sites. And we know that factually, that incivility is not only what we do, it's what we don't do. In other words, when we stay silent, when we don't speak up, when we fail to acknowledge a coworker, when we don't pitch in, when we fail to support them, when we ignore them, when we marginalize them, when we withhold important information, particularly in our world of healthcare, that is uncivil and maybe even beyond. So the next concept I kind of want to talk a little bit about is, what is bullying? And bullying is a persistent pattern of abusive behavior, often characterized by a person asserting power over another. And it's usually designed to intimidate or harass or humiliate another person. The next concept is what we call workplace mobbing. Now, there's a lot of attention being paid about workplace mobbing in scholarly works, not only in organizations and businesses outside of healthcare, but including healthcare and academic settings such as higher education. And I often call workplace mobbing bullying on steroids, because what we have in that case is what I like to describe as a soul crushing experience, where an individual or a group of individuals enlist others to collude against a coworker or group of coworkers with the intent to ridicule, humiliate, marginalize, and so forth. And sometimes it is so uncomfortable that we lose people in our workplaces, and sometimes our high performers, because of workplace mobbing. And the physical, psychological, emotional, spiritual damage, again, that this person on the receiving end of the maltreatment receives can be very, very challenging. The next concept I'd like to talk about is rankism. And maybe some of you have heard that term. It's a term that has been made popular by Dr. Robert Fuller. And I became aware of Dr. Fuller's work about 2 decades ago when I read one of his first books that was titled Somebodies and Nobodies: Overcoming the Abuse of Rank. And he was talking about rankism as the abuse of power to demean or disadvantage another. Now, he clearly asserts that there's nothing inherently wrong or bad about power and rank. We need power and rank. In fact, those of us in higher ed achieve a certain level of rank through our systems. Instead, it's the abuse of power and rank that we must avoid. And he called rankism the mother of all isms. He said it's like the big cancer. So if you think about the big cancer as an umbrella, that underneath the umbrella of the big cancer, we have things like breast cancer and lung cancer and colon cancer and all the other cancers. And what he said is that rankism is like that big cancer, because under that umbrella of rankism, we have things like ageism and sexism and racism and all the other isms, where one group is abusing their power and control to disadvantage another. And Dr. Fuller says, and I agree, and I'm sure you do as well, that this behavior is inexcusable. And that he asserts that the antidote to rankism is showing dignity and respect, and I would say civility toward all. Now, sometimes these acts of workplace aggression can be intentional or deliberate. But many times, in fact, in the majority of times, at least in my experience, a lot of these behaviors are unconscious, they're unintended. But here's the thing, whether they're intended or not, the impact can be devastating and certainly far-reaching. Let's talk a little bit about the detrimental impact. And again, this is a list that you could certainly enhance, but I'll name just a few, especially in a practice-based discipline such as ours in healthcare. We know that if incivility and other toxic workplace behaviors occur, that it can have a negative impact on patient safety and quality care. That's way at the top of the hit parade. It also lowers our clinical performance. I, as a nurse, cannot perform as well if I'm being disrespected or treated in ways that might be bullying behavior. It diminishes our clinical judgment. It heightens our level of moral distress and burnout. We are less able to collaborate and communicate and work as a high-functioning team. It reduces our morale. It increases our intent to leave, to get out. And it also increases our vulnerability to physical and mental health conditions. So our job is to help foster a healthy work environment. And particularly when we think about it within the lens or the context of the work of leadership. So to begin, I want to spend just a few moments thinking about what is leadership? What do we mean by it? So before this conference, a couple of days ago, I did a Google search. And in the search bar, I put the term leadership. And I came up with nearly 3 billion hits. So we know, you know, that we have this huge body of literature and work on leadership. But I thought I would distill some of that down for us just to provide a bit of foundation for today's discussion. And first, leadership is an art and a science of engagement and influence. Leadership is envisioning and co-creating and enabling a desired future to achieve a common goal. Leadership, this is one of my favorites, leadership is a lifelong journey. It's not something that's a one and done. We're constantly evolving in our leadership capacity and acumen. And my personal favorite is that leadership is synonymous with relationship. This is nothing that we do alone. So let me share with you some additional thoughts on leadership and what I call peak leadership. And so as a professor, so I taught nursing leadership and management, taught several other courses, but taught nursing leadership and management for 20 years at the university level. And my nursing students and I frequently engaged in quite a spirited dialogue about characteristics and qualities and attributes of highly effective leaders. And we would have good discussions about how there can be leaders who are very influential, but they could also be unethical, corrupt, dishonest. So we had an agreement that whether we were talking about titled or formal leaders or untitled informal leaders, that we agreed that as leaders in any capacity, that we should aspire to be peak leaders. So thus the acronym. So if I deconstruct it just a little bit for us, P is for principled leadership, that authentic and true leaders use principles and values to engender trust and respect, to guide our decisions and to determine direction, especially in turbulent times, and knowing that our principles are our true north. Principled and then ethical. E is for ethical, doing what is right and honorable rather than what is expedient or convenient or in one's self-interest. A is for authentic. It's really carefully examining our motives and our goals and our core values and being aware of our strengths and our limitations and being cognizant of how our behaviors impact other people. And lastly, but certainly maybe my favorite, kindness, that leaders are kind, that leaders lead with benevolence and compassion, and they refuse to see kindness as a weakness, but instead a sign of strength and courage and mettle. So as we think about our leadership skills and journey, certainly it behooves all of us, and I'm certain that all of you have crafted a personal vision and mission for your life journey. It must be guided, this life journey must be guided by defining a positive vision for our future. And so I want to just talk for a moment about Viktor Frankl and his work. So as we contemplate a positive vision for the future, let's think about Viktor Frankl's work, his riveting book titled Man's Search for Meaning. And again, I'm certain many of you have read this. When I worked as a professor, in my professor role, this was required reading. Parts of this text were part of required reading for my students. And as a behavioral health nurse, my training as a strategic cognitive therapist, we read a lot about Frankl's work in terms of logotherapy. But I want to talk about it in the context of his grueling experience in a Nazi concentration camp during the Holocaust, when the book inspired this book. So this is Frankl's gripping account, which describes the power of vision that enabled prisoners to find a reason to live under the most despicable and deplorable conditions perhaps ever perpetuated on humanity. And Frankl concluded that the meaning of life is found in every moment of living as well as suffering, and that each of us strives to find meaning in our life, and that is the primary motivation in human force. You see the quote there, and I want to get to that in a moment, because as we consider our personal professional vision of our future, let's think about the legacy we wish to leave. And it's important that we do that, because whatever legacy we leave, it will be indelible. So I ask myself, and perhaps you ask yourself, how do I want to be remembered now, during the pandemic, after the pandemic, in life, How will others describe me? How will they define my role in contributions? Because how we act matters because it reveals our character. And in the words of Viktor Frankl, those who have a why to live can bear with almost any how. So, which brings me to the question, what is your why? And I would imagine that many of you have crafted your why, but we know that successful leaders know and can articulate well their why or their purpose or the reason why they do what they do. Why statements are really powerful proclamations that express our unique contributions and impact. Why statements can be organizational, so you may have crafted one on your organizational level. Why statements can be team or tribal. Why statements can be individual. And Simon Sinek suggests that a why statement is something that's well thought out, affirmative, actionable, and applicable to everything we do. So it's a single sentence that reflects our life's purpose and reflects the difference we wish to make in the world. Now, again, I'm certain that many of you have a why. If you do, feel free to chat it in and share it. But for those of you who maybe haven't crafted or developed your why, and mine continues to evolve probably like your why, but I thought I would share my why just as one example. So my why is to lead, inspire, and champion civility, inclusion, and belonging around the world. So that manifests itself everywhere, in my neighborhood, in my work, at the dinner table. In other words, reflecting that sense of inclusion, respect, belonging in my everyday practice, and certainly in my nursing practice and my academic experience. So we know that leadership requires a deepened emotional intelligence, and I know we have a wonderful speaker talking on that topic later in the conference, so it's not my intention to get super deep into that, but certainly leadership requires that emotional intelligence and that heightening of self-awareness. And it requires us really to embark on a continual journey of self-discovery. And if you believe, as Socrates said, that an unexamined life is not worth living. So we really need to take a look at what it means for us to be an effective leader and to change our work environments. So this is a definition of a civilist that I've been working on for the past couple of years, actually for many years, but finally put it to paper to say, what is it that if we aspire to be a civilist, what does that really mean? And what are the attributes of that? And a civilist is one who consistently models the attributes and qualities of a civil, respectful person. They honor diversity and inclusivity. They have a principled character, demonstrate responsible citizenship, invite and respect the perceptions of others or perspectives of others, and they create a genuine sense of belonging. And so when we think about modeling these qualities, it really requires each of us to have the courage and the commitment to make an honest appraisal of who we are and how we come across to each other, to really reflect inward and establish a clear sense of ourselves, and to have values and principles that help us lead a purposeful and meaningful life. And we all have the capacity to be powerful role models. I often say, you know what? We are all role models, but we have to ask ourselves, what are we role modeling? Are we role modeling those attributes and behaviors and qualities of a true civilist or respectful person? So I developed the Everyday Civility Index to measure civility in our everyday interactions and activities and encounters with people. I created it because I began witnessing, as you probably have, more and more acts of incivility and sometimes downright aggression and hostility toward other people. And I absolutely firmly believe that for us to move forward and to collectively meet the goal of inclusivity and belonging, that we need to examine how we communicate with one another, how we interact with one another, and how we endeavor to strengthen our ability to interact. So in a minute, I'm going to lead us through the Everyday Civility Index, and you'll be able to measure your perceived level of civility, which encompasses not only the work setting, but our workplace, our home, our community, our neighborhood, the public square, however you define it. So the index, it consists of 20 items. And the true intent of the index is to measure civility, if we had time, using a 5-point Likert scale. And that would provide us with a lot of gradations, and it would probably give us a more accurate reading of our civility index. But because our time is short, I'm going to ask that we use binary responses of yes and no for each item. So you can keep track on a piece of paper, your fingers and toes, in your head. No matter how you do it, keep track, because every time you say yes, that's a point. So please count carefully. And because at the end, I'm going to show you a ballpark range of where you fell in your index. One last thing, because none of us are perfect, I'm going to begin the index, each item, with a stem that goes like this. Do you, yes or no, 90% of the time, yes or no, okay? So keep track, and here we go. So here's the index. Do you, 90% of the time or more, assume goodwill and best intentions? Do you use respectful language with no racial, ethnic, sexual, gender, age, weight, or religiously biased terms? Do you listen to learn and understand? Do you express gratitude and say thank you? Do you avoid negative gossip and spreading rumors? Do you maintain confidences and respect others' privacy? Do you appreciate and seek to understand the experiences of others? Do you avoid abusing your position, influence, or authority? Do you volunteer and contribute to the greater good? Do you avoid exploiting, belittling, or taking advantage of others? Do you speak up and advocate for those harmed or maltreated? Do you celebrate achievements and accomplishments of others? Do you take personal responsibility and accountability for your actions? Do you set aside your phone or your device when you're having a conversation with someone? Do you reach out to help neighbors and others in your community? Do you demonstrate inclusivity and appreciation for diversity? Do you seek and accept constructive feedback from others? Do you respect others' opinions and opposing points of view? Do you avoid assigning blame to others for your own shortcomings? And do you apologize and mean it when the situation calls for it? Okay, got your score? Here we go. This is a ballpark. So, how about your score? Are you happy with it? Are there, and we can, when we go to discussion, I'd love to hear some thoughts on that. Are you happy with your score? Are there areas that you really nailed it and you are, you exceed and you excel? Are there areas you'd like to improve? Here's the thing, though, before we close on the Everyday Index. The way the index is really intended to be used is that I might invite a trusted colleague or a friend or a family member to do it with me. So let's say that one of you and me are trusted colleagues. So separately and in a quiet space, I'm going to do the civility index on myself, and I'm going to do it on my perceptions of you. You're going to do it on yourself and your perceptions of me. And then we're going to come together and have a conversation about our perceptions of one another. And I heartily suggest that if you have discovered or uncovered several areas of improvement for me or vice versa, that we only talk about one. Because if you share a lot of things I need to improve, I might feel really sort of demoralized or defeated and not a very good teammate or friend. And so having the discussion about one area for improvement, but if there are lots of strengths, I say bring it. Let's have that conversation as well. So more on the civility index a little bit later. And there are certainly other ways to improve self-awareness. I mentioned emotional intelligence, which I'm really looking forward to our later session on that. Knowing and growing our strengths, practicing empathy, really genuinely asking for feedback and incorporating that into our lives, and really thoughtfully and intentionally examining and addressing our conscious and unconscious biases. So if we were to use the pathway, let me just check my time. If we were to use the pathway to foster organizational civility to transform our workplaces, the pathway actually has 8 steps, but I'm going to abbreviate a few, summarize others, elaborate on what might go into the pathway in terms of an action plan, because I think that's most what people are interested in. So the very first step of the pathway is that we need to have leadership support. Now, definitely leadership at all levels, but here I'm talking about executive leadership support. That is essential for us to transform and have sustainable change within our organizations. It requires systemic change throughout the house or throughout our organization, wherever we might be. Leaders not only have a vested interest in the organization, they often have a broader view, though we want to have a shared view of what's going on within that organization. But they are able to provide the necessary resources that we're going to need to transform the culture, whether it's human capital, social capital, financial, time, otherwise. We're going to need resources to be able to do this hard work of transforming the workplace. We also need to do measurements because we need data. We need to know what's going on. And I'm talking about really getting gritty and granular in our organizations. Every organization, department, unit, school, you name it, we all have a unique history, culture, workforce. So in other words, because we're all different and unique, we really need to do a cultural assessment to determine what are our areas of strength and excellence, and where are our areas for opportunities and growth. And so we can assess the culture in a whole bunch of different ways. So it might be that we're using empirical instruments to do that: satisfaction surveys, interviews, focus groups, listening sessions, open forums, any number of ways of collecting good data and ample data to really understand what's going on within the cultural environment. And once this data is organized, it can be formulated into a data-driven action plan, which I'm going to talk about in just a moment. But it's also important when we're talking about measuring workplace or organizational health that we have a process where it's not just once that we measure it, but periodically measuring that at various intervals to see how are we doing with our progress? Are we moving the civility needle at all? And it also helps us identify reasons to celebrate and those gains that we're making. So I also highly recommend, and this is part of the pathway, that we assemble and empower a civility team or a culture team. I've helped to assemble a lot of them. I've also been a member of them. I've been a facilitator of them. And civility teams really are composed of trusted, committed, and empowered employees that are diverse in position, diverse in thought. And they come together, and it's not their job to do all the work. Instead, the civility team is charged with keeping the mission front and center, the mission to drive organizational change and to create and foster a healthy work environment, and assuring that the action plan is moving forward. And just as a sidebar, in my estimation and experience, having a dedicated, high-performing civility team in place to move this initiative forward is one of the top key elements for sustainability. So I talked about the action plan. So part of the pathway is that we need to develop, implement, and then continuously evaluate our data-driven action plan. The assessment data that we collected is formulated into this plan. So it includes our areas of strength, our areas of excellence, but it's also the areas that we can measure that we want for interventions that we want to improve. And each intervention really needs to have clear objectives, expected timelines, and we need to have the necessary resources to do that. Again, whether those are financial, human, time, organizational, whatever those are, it weakens the team if we are not well resourced and empowered to be moving that action plan forward. And the action plan will be different for every single one of us here, whatever our workplace is. But there are some interventions that are so common for most, if not all organizations, that I'd like to illuminate just a few of those. The first one has to do, and now I'm talking about, earlier I talked about our personal, professional vision, mission, and values. I'm talking now institutional, that true leadership involves co-creating and implementing a compelling vision for the future, a shared purpose, if you will, that's greater than ourselves and designed to make a lasting difference. So I'm pretty certain, because of all that we've been through in 2020 and to continue to go through in 2021, that we have gone back to look at our foundational statements for our institution, our vision, our mission, our philosophy, our shared values, to say, hey, do they really truly reflect our current and future reality? Do they underscore our commitment to civility and inclusivity and belonging? If so, that's awesome. But if not, it may be time for all of us to take another look. Do we need to revise or refresh or renew our vision and our mission and our shared values that can cascade us into the future? And we know that healthcare professionals at all levels play a critical role in this, in setting that vision in a positive course for the future. We also know that the ability to survive any crisis like COVID-19 and a pandemic and other crises is that it begins with a vision of what's possible. And we could agree that it would be reckless or irresponsible to ignore that current reality, but it's also unwise to ignore the hope for the future. And so true leaders, effective leaders, focus on the way forward and setting that hopeful course with others and collaborating with them to strategize for the future. Now, I'm often asked, what's the magic potion? What's the secret sauce? What do we do, if nothing else, to create a healthy work environment? And of course, the answer is not a simple one. The process is messy and complicated and complex, and ever changing. But if I were to suggest one or two top interventions, this would be it. That we work together to put a team charter, a civility pledge, a commitment to coworkers, whatever we want to call it, and really have that deep discussion about what is our commitment to one another. How are we going to interact? What will those encounters look like? How will we be respectful and professional with one another? And they need to be aligned with the vision, mission, and shared values of our institution. And we have a pledge that when we disagree, because we will, and that's good, when there is conflict, we will restrict our differences, if you will, to the issue at hand while still respecting that person. And we talk about norms, co-creating norms. That's really sitting down as a team, all members saying, how is it that we're going to be with one another? And these really become the bedrock or the foundation for our interactions. And I have an example here on the next slide, because norms are really necessary for effective team functioning, committee functioning, and they need to be utilized ongoing, because they are living documents or a touchstone for how we behave with one another. So here's just a few examples. So you see that, and this one is a group of examples that we might have in our practice environment, that at the top, that we are committing as a team to unequivocally commit to patient care and safety, that is our pledge to one another, that we're going to be considerate, we're going to use respectful communication, and so on. We're going to honor diversity. We're going to be open to other points of view, and definitely hold ourselves accountable for these norms. So another aspect that item that we might have on our action plan is to really pay attention and to build high-performing teams. And one of the most important lessons we learned from the 1918 pandemic was the vital need for collaboration, the world working together, building relationships. And I believe, as you likely believe, that is ever more true today, that we really need to focus our attention on building and sustaining meaningful connections and building strong teams, sharing stories, celebrating team and program successes, and really being present during our conversations. And for example, asking ourselves, and maybe this is the cognitive therapist in me, asking ourselves questions before certain encounters, like, what might it be like for that individual right now? What might they be experiencing? What might their journey be like right now? And this helps to put us in a mindset of support and empathy and collegiality and goodwill. So another thing or item on our action plan is civility education. Because think about it, I know often I ask people, how many of us have been educated on this topic of managing conflict, sitting down and really doing the hard work of deconstructing that conflict and coming up with common ground solutions. And so this really needs to be ongoing, comprehensive, and hands-on, using interactive kinds of activities where we can practice, because talking doesn't do it. Talking is part of it, but we've got to do it. One of the techniques that I often use when I'm with groups on this topic is using cognitive rehearsal. Now, cognitive rehearsal, some of you may have used it and know that it's a behavioral strategy where groups or individuals work with a skilled facilitator and they practice and rehearse effective ways to address conflict or stressful situations, including uncivil encounters, which is much of the work that I do. How do we respectfully address incivility when it occurs? And so facilitators of cognitive rehearsal use role play, simulation, and have the people involved rehearse that uncivil situation. They're being simultaneously coached, and then we debrief it and really try to figure out how we might address this situation in today and going forward. It's really an incredibly powerful combination of skill sets and likely to lead to a more positive outcome of team collaboration and ultimately protects worker and patient care. Another item is that we need to have policies, well-defined policies, step by step, addressing incivility and ensuring confidentiality and being widely accessible and easily accessible and widely disseminated. We need to have skill building, particularly around communication and conflict negotiation. Some people call these soft skills, and I prefer to call them power skills because they are some of the most difficult skills for us to hone and master because every situation is different. The people involved are different, and they require practice, practice, and more practice. And we need to role play, as I said before, and debrief, particularly situations where patient or worker safety is at stake. Hiring for civility, making sure that we don't settle in our hiring practice, but being rigorous and diligent about vetting our candidates for collegiality and character and teamwork and building that into our performance evaluations. Are people living out the values and the vision and mission of our organizations? We also need to have resources for stress reduction and self-care. And as a behavioral health nurse, this topic is very near and dear to my heart because each of us, I believe, needs to have a plan and to implement it to enhance our personal and professional well-being because healthcare professionals are experiencing unprecedented levels of stress, increased suicide rates, moral distress, burnout, substance abuse, you name it, and all of these pose significant health and mental health concerns. So the need for fostering stability and healthy work environments, I believe, has never been greater. And lastly, we need to reward civility. We need to celebrate civility and accomplishment of desired behaviors. We need to recognize each other and our teams. These celebrations can be formal, informal, they don't have to be expensive, but acknowledging and celebrating are ways that we foster a healthy work environment. The role of leadership really involves elevating and empowering others. And the great part is we get to choose the type of leader we want to be. I often used this quote with my students when I was a professor. I've also used it with my children, and you've probably heard it. A rising tide lifts all boats. A rising tide lifts all boats. And I am extremely optimistic about a promising and positive future that lies ahead. I also believe that this revolution will be led by healthcare professionals, us, the collective and unstoppable us. So thank you for your amazing work that you do every single day to make the world a healthier and happier place. I want to thank you for your time. I'm grateful for it. And now we are open for a few moments of questions and discussion.